Hi, second YouTube video of the day, because I felt, after listening to the radio for a couple hours, that I had to say something about the healthcare debate going on. This debate, I feel, is being hijacked by people that want to see Obama fail, by conservative people that are pissed off about other things, or by people that see it as the demon socialism. If you have described Obama as a Nazi even once, I'm not talking to you in this video. You're welcome to listen, but you're not who I'm addressing because I consider you hopeless. Anyone that would draw that comparison is absolutely ridiculous. But for the rest of you who may be starting to feel conflicted on this issue, let's talk about it a little bit. One of the big arguments is, well, it sounds good, but we can't afford it right now. Don't you know we're broke? We can't afford not to do this. What happens is people without health care don't go to the doctor. They can't be turned away for emergency care, though, and eventually it becomes an emergency because whatever is ailing them goes untreated. They then go to the emergency room and they're taken care of, and guess who pays for that? You. It would actually cost us less to make sure that there's insurance for everyone, and a public option is going to do that. Now, the socialist argument. First off, let's accept that there are many socialist components to our system now already, okay? There's Social Security, there's public education, there's public roads. There are situations where the government competes with private industry, like the post office, even public schools. Private schools still seem to be flourishing. We haven't driven them out of business, but every kid gets an education. It's not always the most quality education, and I, for one, complain about it a lot. It should be better, but if you look historically, it sure is better than what people had even just, 4 or 5 generations back. Maybe not as good as one generation back. So, with that said, oh no, the current insurance industries are going to have to compete with the government. That's not fair to them. Fuck them. I feel very strongly about that. Fuck them, because they have been fucking us for a long time. In wanting to have my arguments sound rational and intelligent, I usually don't use that kind of language, but you're talking about people that have preyed on us for ages in the most ruthless, money-first kind of way, and I'm just having a really hard time being all that concerned about hurting their profit and bottom line now. I have a feeling they're gonna do okay. Are you really... you gotta stop and think about this. Are you really going like, but this isn't fair? How will the insurance companies make their billions of dollars off of our healthcare? This is a vital human need. This is not something that they should be able to make that kind of profit off. Sorry that I'm not more researched on this, because I wish I could say which country it is, but at least one South American country has said, we are going to not enforce patents or copyrights on drugs that treat deadly diseases like AIDS. Awesome. That's not a place where you need to make your profit. People say, well, what about research? Where will be the incentive for research? I just don't see that the incentive for curing AIDS is really going to dry up. There's still tons of money to be made without it, the drugs for it being so overpriced that nobody without insurance that so many of us don't have could afford it. The fact is, there are people dying of it that don't need to be dying of it, and that's wrong. And when someone else is willing to make a generic version of that, great. The government option is going to be so terrible. It's going to be forced on us, and it's going to be awful. Read the legislation, and people say, oh my god, it's so long, it's so many words. It's not. If you really look at it, it's not much longer than your average insurance policy. So actually go through and read it. It's not going to be forced on anyone. You can't simultaneously complain that it's going to be competition for the big guys and force them out, and that it's going to drag them down in quality. Is it going to make them, not be able to compete, or is it going to allow them to be even sloppier? I see a conflict there. And the fact is, what we have now, because people have to have something, what we have now is far worse than it could possibly be. If the option is the big health insurance companies or nothing gives you terrible service and costs the taxpayer more than giving them this public option will cost them. And then last, how good is your health care now? What are you grasping to that's so great? And I'd like to invite people to make reply videos to this. But one thing that I would request is I would love to hear some horror stories like the ones I've been through on the kind of health coverage that you have now. Because I've got crap. Okay, and I'll give you a couple of quick stories. I had a doctor walk in and tell me what he was going to do to treat my Crohn's disease. And I said, I don't have Crohn's. And he said, yes, you do. And I said, no, you tested me, I don't. And he said, Keith, I'm really sorry, but you must have misunderstood at some point. You have Crohn's. And I almost started crying, because I really don't want to have Crohn's. I was having a hard enough time coming to terms with having ulcerative colitis. I said, get my folder. And he says, I was just reading your folder. I said, get my folder. And I'm getting really pissed. And I realized that I'm a very vocal, outspoken person, and a lot of people wouldn't have done this and would have taken the medication for their Crohn's. But I'm yelling at him, get my folder. I need to see it in writing. He goes and gets my folder, and he comes back laughing and says, sorry, I was looking at the person before you's folder. You don't have Crohn's. Great. That's wonderful. I went and reported him, and nothing happened. So I said, give me a different doctor at least. I was given a different doctor for a couple of months, and then got transferred back to him again. And finally just quit UC Davis Med Center. And now I'm somewhere else. I'm not afraid to mention them by name because they almost killed me. Well, hurt me. Anyway, I have another friend who is standing, waiting to go in to have her gallbladder removed, and she has to fight with them because they're saying she already had it removed the week earlier. She's saying, where are the scars? Why don't I remember? I think I would remember if I had my gallbladder removed. And this person actually stood there and fought with her about it. It's gotten to the point where we're really just channeled through. This is a big business, fast food kind of healthcare. And why people so desperately want to hang on to it, I don't understand. Because I see the people out protesting, and so many of them are working class people like myself. The worst horror story I can tell you is that I lived without healthcare until I got into my 30s. I lived the majority of my adult life so far without healthcare. And when I would hurt myself, I dealt with it. You know, I have a friend who reattached his muscle to his leg by wearing his wife's support hose for a couple of months after an injury. And you can still see the bump where the muscle attached to his leg lower than it should have because he didn't have health care. Personally, if I was him, I would have gone ahead and put myself in debt tens of thousands of dollars to get it done right. But that was his option. And this is a working class guy who works for himself. He's an artist, and when he's not making his living off of his art, he goes and he paints houses. You know, he had to work, he had to make his living, and he didn't have money to go and get taken care of. So I'm a little emotional about this one, and you all should be too. This is a really important thing. So let's get active and as loud as the opposition is. This is something that we need. It's something that we deserve. It's something that the rest of the world has. I mean, it's pathetic, America's ranking when it comes to healthcare, to infant mortality, to our life expectancy. It's sad, and it's not where it should be. So we can't afford not to do this. And let's get it done this time. We've had so many attempts foiled and thrown away and corrupted. I love the comment section on my YouTube video. I moderate it. I moderate it a little heavier than a lot of people. It doesn't mean that I'll delete you if you say things I'll disagree with. Unless you drop into a name-calling little temper tantrum frenzy, I will let you speak your mind, and a lot of other intelligent people will reply, and it's a really great place for discussion. So please, participate in reply videos and also in the comment section, and let's talk about this and ask the questions that you have. If you do disagree with me, awesome. Let's talk it out. It's important. So I'd like to see that discussion happen, and think this is as good a place as any for it. And one last thing to add. There's a component to this that really shouldn't be in the national dialogue. There's nothing in the plan that's going to kill your grandma or unplug her, force euthanasia on anyone. And that's just the most extreme of a lot of bullcrap. It's ridiculous that we have to fight stuff that isn't even in there. You know? So please be careful about what you believe. Thanks. Please, make reply videos.